Hi, my name is IsaacHolguin, and I am a clinical educator for my hospital system. Today we're going to be discussing the process for a wet to dry dressing change. The goal of this instruction is to help others attain a psychomotor precision level of mastery, meaning you'll be able to perform this skill independently without guidance in real time. So, I've always said for any nursing skill, the best way to succeed is preparedness. So what we're going to do is we're going to gather all of our supplies before we enter the patient's room, and we're going to make any considerations for that patient before we go in. So what I mean by considerations is your dressing changes are usually an uncomfortable process for them. So what we're going to do is we're going to call the nurse ahead of time if you were entering that room to do the dressing change on someone's behalf, or if you're the nurse, make sure that you are the one who is medicating them for pain prior to doing the dressing change. So typically 15 to 30 minutes prior to starting is pretty acceptable for pain management, depending on whether you're using IV medication or oral medication. And once you've done that, make sure you have all the supplies. So for this dressing change, I always like to have a Chuck's pad, which will give us a nice area to set up on and help contain our mess, absorb any exudate or any saline that we may spill, a pair of scissors, a top layer dressing with your initials, the date, and the time written on it. You can pre-write it like I have here, or you can take in something to mark it after you've completed your dressing change. We'll need our packing material, which is just acrylic roll in this case. Some gauze pads just to help clean the wound. And then packing strips if you're not going to be assessing your wound by hand. I always like to take a pair in just so I can kind of measure the depth of any tunnels I may find. And then lastly, for this dressing change, it's just a regular wet to dry. We're going to be using normal saline. Now, after we've gathered all of our supplies and we're ready to go in, the next thing we're going to do is introduce ourselves to the patient. So normally I'll come in and say, "Hi, Mr. whatever the patient's name is," verify with their wristband that I have the correct person. And then I will say, "My name is Isaac. I am the wound care nurse. I'm here to change your dressing." The next thing we want to do is give an approximate time for about how long we think the dressing change is going to take. For your normal moist to moist dressing changes, I usually say about 5 to 10 minutes is acceptable. After we've said that, I always like to just double check and make sure they've been medicated for pain. So I will ask the patient, "Has your nurse come in with your pain medicine? How are you feeling?" And once we've established that, we're ready to begin our dressing change. So first, we'll do our hand hygiene, whether that's hand sanitizer at the door, clean your hands really good. And then we're going to don our first pair of gloves. So we're going to change our gloves multiple times throughout a dressing change. I usually start with a single pair of gloves like this to take down the dressing, and then I will double glove for the dressing change itself, and I'll explain why in just a moment. So now that we have our gloves on, we're going to remove the old dressing, and when we're removing the tape, I always tell people not to pull straight up because that's going to put tension on the skin. We're pulling it away, and that causes skin tears. So instead, we're going to use a horizontal along the skin peeling technique all the way around like this to minimize that tension on the skin. Now, once this is done, we can throw away that top layer dressing. And then we're going to take out the packing for the dressing. Now, I recommend you take a quick look at how this dressing is packed. It's hard to see here, but if I lift up this edge, we'll see we're covering the skin, which is a route for bacteria to get into this dressing and then into the wound. So we'll talk about proper packing technique, but we don't want to have anything overlapping here. We'll remove all of that packing, and then we'll throw that away. Now that we have the wound exposed, we're going to change our gloves again. And this is where I will put on 2 pairs of gloves. Now the reason I use 2 pairs of gloves is because the first pair is the one that we're going to use to explore the wound. whether that be with the packing strips or directly with our hands. Understandably, that's going to get our gloves very dirty. We don't want to put dirty gloves on clean dressings. So we can just strip off that pair, and then we'll have a nice clean pair ready for us right beneath. All right, there we go. So we have our next clean pair of gloves. When you're checking the wound, if you need to measure the wound, you're going to take your strips here, and you can either measure it with these directly, or if you have a little ruler, you can do that as well. I'll usually use the strips, and I'll always measure a vertical measurement, a horizontal measurement, and then a depth into the wound. Once those have been done, if you have undermining or tunneling, you can take these out, insert it into that tunnel, and wherever your hand hits the depth of that wound, when you pull it out, that's what you're going to measure. And you'll do the same thing for any undermining. If you don't need to measure, like we're not going to today, you can always just take your nice clean gloves and just explore that wound. Make sure that we're going to be filling all this space. And that's really important because any undermining or tunnels that get sealed off are going to eventually cause a little abscess, which can be a pocket of infection, and that can cause us to have to go back in and reopen that wound and start the healing process all over again. So we don't want to do that. Make sure you always explore your wounds. Now, we've already touched our wound there, so we're going to get rid of that top layer. We did all of our measurements. We found some undermining and some tunneling. Now we're going to clean the wound. So I'll usually just open this packet up, pour my normal saline in there, and then we are going to start by cleaning from the center of the wound in circles going outwards towards the edges. Of course, once this starts getting covered with exudate, switch it out, get a new one. And we're going to do that for the entire wound bed until we hit the edges. Once we've cleaned all of that off, make sure you get any undermining in there with another clean one. The same thing for any tunneling as best you can. And then you can throw that one away. Then I'll do one final piece of gauze and just clean up the edges of the wound with that saline damp gauze. Now we're nice and clean. So the last thing we're going to do is get our packing material. So again, I'll open up this package. I'll just pour this directly into my dressing package. And then when I'm ready to pack, I only want this to be damp. I don't want this to be dripping wet. So I'll wring this out really, really good into that package until we just have this nice, damp, non-dripping packing material. Now when you're packing it, I always start with my tunnels. So we'll pack this tunnel right here. And if it was really deep, we could use that measuring stick to really get in there. And then I try to hit my undermining in one long, continuous piece of gauze. Now, when you're packing this, the goal is to fill this wound bed. You don't want to pack it in super tight. You want just enough for it to fill the space and not overhang on the edges of the wound. So we're going to do probably about to right there. Get our scissors, get a nice clean cut across. Get rid of our excess gauze here. And then just kind of nestle it in there to be even with the skin surface, but not overlapping. Just like that. You want it to have a little bit of bounce, and that's just because when you're doing these dressing changes, the dressing is going to soak up exudate over time. And as it soaks up that exudate, it's going to expand, and that pressure created is going to press on the edges of the wound bed, which can stifle wound healing. So now that our dressing is in place, we just have to put our top layer on, line it up nice and neat, make sure nothing is overhanging on the edges. And we are good to go. Try to minimize any creases you may get when you're doing this, because we don't want to damage the skin when they're laying on this. And that's about it. That is how you will do your dressing changes. Thank you for watching. If you have any questions about it, you can always reach out to your local educator, and I'm sure they'll be happy to help you out. Have a good day.